14, it's one of the leading causes of infertility, and it may affect about 10% of women of reproductive age. Polycystic ovarian syndrome, or PCOS, can go undiagnosed in as many as 70% of cases. Fox 23 is committed to covering stories that matter to women, and this is a condition that only affects women. I found out what the primary symptoms are and what it's like to live with. It's on her mind.
The cramps at times, I mean, even typical pain medication like Midol, Tylenol, things of that nature would not even touch the pain that I was feeling.
Irregular periods, heavy bleeding, the cysts on the ovaries, I don't know how many I've had, but they are painful.
Sydney Crinline and Lisa Petty say their symptoms started in their teens, but both weren't diagnosed with polycystic ovarian syndrome until their 20s. Do most women know they have it?
There is more of an idea that this condition exists. That said, we see lots of patients that have seen multiple providers and never were diagnosed. You know, they're just put on, here's a birth control pill or something like that. And really, when you do the workup, you say, this is due to PCOS. You know, let's actually focus on that specifically.
Dr. Corey Babb tells me if you have 2 out of 3 of these criteria, doctors will diagnose you with PCOS. Irregular periods, bleeding for a couple of days 1 month, skipping a few months, then having really heavy period where you bleed for several days and are stuck in bed. Too much testosterone. You may have facial hair, acne or excess body hair, and a blood test can tell if your level is too high. And having 10 or more follicles on your ovaries. A doctor can use an ultrasound to detect that. And Dr. Babb tells me bloating, pain, or irregular periods would all be reasons for an ultrasound. Both Sydney and Lisa tell me facial hair was one of their worst symptoms.
Once I got into my late 20s, I had saved up enough to actually start laser hair removals to get that all taken care of. It's a very painful process. I spent plenty of time at the clinic and I got to know my physician assistants very well, and it's something that they deal with a lot. So they do see a lot of women with PCOS.
I did try laser. It didn't really work. I think it actually might have made it worse.
A lot of patients with polycystic ovarian syndrome will suffer from weight, especially in their midsection. And they can diet, they can exercise, and it's very difficult for it to go away.
Do you feel like they put it back on you, like somehow it's your fault because of your weight?
Oh yes. Oh, definitely. They dismiss. The weight is number one. You feel dismissed, you feel invalidated.
If you would just eat better, or you wouldn't have these issues. I keep track of what I eat by the app on my phone. I have an Apple Watch that keeps track of my exercise for the day and blows me up if I'm not hitting my steps or I didn't do my exercise for the day. I'm doing all of these things, and the doctor's response was, well, be more consistent and do it, like try harder. I've been big my whole life. I've just always been that big kid. So to hear doctors say that, it's just kind of one of those things like, I thought you were on my side. I didn't think that you were also the playground bully.
Dr. Babb says insulin resistance seems to be an underlying cause of PCOS, so treating that can address it and can help women lose weight. Often, when women lose 40 to 50 pounds, their symptoms improve. Both Lisa and Sydney recently started treating their insulin resistance and both lost weight. Lisa is feeling better, and Sydney's having regular cycles and hasn't had ovarian cysts in almost a year.
We need more doctors that are more understanding of it and less doctors that are just quick to kind of toss a birth control pill at it and tell you to have a good day.
The CDC says more than half of women with PCOS develop type 2 diabetes by the age of 40. And Dr. Babb says PCOS also increases your risk for endometrial cancer. That's why it's important to push for answers and get treatment. We want to know what's on your mind. Send us a story you'd like to see told at onhermind@fox23.com.